Hi, I'm Dr. Mike Milligan. I'm here with Dr. Chris Farrell and Dr. John Flutter of MyoBrace. Chris is the founder and CEO, and Dr. Flutter is the senior lecturer for them and has many lectures in his own right. Chris, thanks so much for being with us.
Yeah, pleased to be here.
John, thanks so much.
Good to be here.
So we're here to talk about MyoBrace. Tell me a little bit about what MyoBrace is. You've been around about 25 years now?
Well, we started 25 years ago with the philosophy that we wanted to promote better health in children, and one of the areas is looking at myofunctional problems associated with orthodontics. And we feel that it's always associated. Every malocclusion has a myofunctional issue, and every myofunctional issue has a health issue. So we developed an appliance system that helps with that, and obviously an education program to go with it to help these kids grow better and maybe make orthodontics a bit easier to do.
Now, you talk about kids with a malocclusion. What percentage of kids does that comprise? Who are we helping here? How many kids are we helping?
Well,
about 85%.
When we look at the statistics now, I mean, most kids have a malocclusion. Right. I mean, you go to any community, you might find one or two that don't have a malocclusion. We say 75, 80%, but a lot of kids. I mean, most of our kids have got a problem, and really we really should understand the problem better, and we should be treating it better, and that's what we're all about.
Right, and so when you have a malocclusion, crooked teeth, it's really not about the teeth. There's an underlying problem, and that's what you teach the dentists out there.
Well, I think John's really the expert on that. He's saying every time you see crowded teeth, that's a symptom of health, wouldn't you say, John?
Yes, I'd say that when you see crooked teeth, you know that the growth and development of the cranium is not developing as you'd like it to do. And so when you've got a distorted cranium, which is poor growth and development, then the teeth will be crooked. The problem isn't the crooked teeth, the problem is the poor cranial growth and development.
Right. And so with your program, you're getting the growth and development under control, and the oral habits, the muscle function under control, which then the teeth follow. But in doing it that way, instead of just straightening the teeth, the entire health of the child improves because their breathing is better. Can you expand on that just a bit?
I think you go talk about the fundamental building block is the breathing, isn't it, John?
The breathing is the most important thing.
Absolutely.
And when the children are breathing through their nose, they have their mouth closed and the tongue resting in the roof of the mouth. And the tongue is the orthodontic appliance. The tongue is the appliance that helps grow and develop the upper jaw to the correct shape and the correct size. And if the tongue isn't in the roof of the mouth, then you won't get good cranial development, and mouth breathers can't have the tongue up in the roof of the mouth. Okay. So tongue in the roof of the mouth, nose breathing really is the critical two factors that we're looking for.
Lip closure, correct swallowing, changes the whole dynamic and health of the child. And we're talking children, typically age 5 to 15, wouldn't you say, is the main children that you're treating?
We try and treat as young as we can. It's easier to change growth patterns in younger children, and the poor myofunctional habits are easier to correct if they've been there for a shorter period of time. So treat young, yes, that's what we try and do.
Treating young, you can treat better, you can make these kids much healthier, and treat faster by getting them as they're developing.
Yeah, I think one of the problems we have, tends to change the paradigm of orthodontic treatment. We're so fixed in this late treatment, treating the permanent dentition, and we come along and say, well, we should be treating early, but it's not about early orthodontic treatment, it's about treating kids for their growth and development problems, and the ultimate goal is to have them to have straight teeth naturally. And really it's still orthodontics, but it's really about growth and development.
And then the straight teeth follow. Why is this so prevalent in today's society?
Oh, malocclusion, I think because health issues in children are a big issue.
So how do we treat? How do we treat these kids? Are we going to, why don't you go over that? It's more the myofunction, and then some appliances to help the tongue and the lip do the right changes as opposed to fixed braces.
Yeah, well, I mean, I developed the appliance system 25 years ago, and everyone said, well, it couldn't possibly work. How could it have something that was one size fits all and only worn an hour a day and plus overnight work? Well, it's working on the functional issues, and some of these are invisible. So the appliance system is by research, it's showed that it's changed its function. So we change the function of the oral musculature, we get the children to breathe through the nose, and that's the appliance system, but the appliance system is only one aspect of it.
And these are removable appliances.
They're removable appliances. I mean, the simplicity of the appliance system it belies the complexity of what we're trying to achieve, and then we have to work with children to get them to breathe through their nose, put the tongue in the right position, so you have to get children's cooperation. So we've got appliance systems and we've got education systems. Those two, if they're not put together, we get no result. That's the problem here. You get no result if you don't put every effort into getting compliance. But that's where MRC has been working for the last 25 years, not only on making better and better appliances, we've got better and better communication with the children.
Much better communication and motivation and compliance for the kids.
And I think where John and I, we communicated over that period of time, and we both developed this attitude that it's really not the appliance, it's how well you get the children to change their function, and that's important.
Right. So what kind of percentage of success are you having with these kids? Not only straightening their teeth, but also improving their health in so many ways by improving their airway and their breathing and their lip closure and swallowing patterns.
I think John will comment on that. I think just the one aspect that we get across the parents, if you get a child to breathe through the nose, and what are the changes that happen?
Well, what I say is the single most important thing you can do to improve a child's health is to establish nasal breathing. Nasal breathing is the cornerstone of a healthy biochemistry. And if you've got a mouth-breathing child, you've got a sick child. And by establishing nasal breathing, what percentage do we do that in? The majority of children, I wouldn't say we do it in 100%. Cooperation is the key, and the key to cooperation is to try and set up a facility to help and support the children.
So where do we get more information?
Well, myresearch.com has pretty much got everything you need to know. MyoBrace.com is our parent site where all the information is for the parents. And this movement is driven by the parents. The parents really want something better for their children, and MyoBrace.com really is the engine that drives us as professionals to do something about it.
You bet. And so where would we find a provider? How do we find a MyoBrace provider?
MyoBrace provider found directly through the MyoBrace.com website.
Through the website. Yeah. Wonderful. Well, thanks so much for being with us, Chris.
Thank you.
Dr. Farrell and Dr. Flutter, thank you very much.